Dr. Jaffe, what dose of potent Seaguard powder would you recommend for children? So ages ranging from 3 to 12 years old, and would you recommend starting with a sea cleanse for them?
Well, very good question. Let me give you the general answer, and then I'll give you my specific answer. When we look at children, there is, in research at least, a distinction made about every 3 years. So 6 to 9, 9 to 12, 12 to 15, 15 to 18, and after 18, you're an adult. Many people have tried to determine what is the ideal dose, what is the proper dose, what is the correct dose at different ages. What I have found at all ages, and I mean from 6 up, is that it's very hard to predict how much ascorbate that individual, whether they're full grown or not, it's hard to predict how much ascorbate they're going to need, because the ascorbate is based on how much oxidative stress, the so-called allostatic homeostatic burden, how much toxic matter are they dealing with. So as long as the child is, say, 6 or above, which means they can understand and cooperate, then yes, a sea cleanse is appropriate for anyone 6 or above to determine how much per potent Seaguard, how much fully buffered, fully reduced L-ascorbate the individual needs. And I can tell you from anecdotal observations, sometimes when kids are not well, they can have prodigious needs temporarily for ascorbate. And by prodigious, I mean it's not unusual for a 6, 7, 8-year-old child to need 10, 20, 30 grams of ascorbate in order to poop. Now, if you have a child who is a special needs child, then we have to deal with that individual, and we're happy to have a consultation done so that we can design how to safely and effectively determine how much ascorbate the special needs child has. And by the way, they tend to need more than the healthier children. So very important question. And I hope folks understand that it is safe to do a sea cleanse in essentially any sentient adult. That is, anyone who is able to say, yes, I want to do this, and is willing and able to comply. And I include people with colitis. I include people with enteritis. I include people with enteropathy. And I especially include children who are in need for whatever reason, either because they're just going through childhood illnesses or because they have special needs. I can tell you in the case of my own children, there were times when they were 6, 7, 8, 9 years of age where they seemed to need, and certainly seemed to benefit from, 30 to 50 grams of ascorbate based on their sea cleanse, taken daily for a few days until they were back to themselves. And then it took much less to cleanse, and we reset the daily intake to what was based on their repeated sea cleanse. So now we have a tool, a non-invasive self-assessment tool, that's been validated over decades, and that I think is the way to go, rather than trying to pick a dose, which I think is, unless you're psychic. If you're psychic, you can pick the dose. But if you're not psychic, and I recommend 2 psychics have to agree before you use a psychic to determine dose. But if you want the physiology before pharmacology approach, please use the sea cleanse in anyone 6 or above.